Hello everyone, I'm very thrilled to welcome today Mark van Vugt, Professor of Evolutionary Psychology at the Vrije Universiteit, and Jay Narayanan, Professor for Organization and Management at the National University of Singapore. Mark, Jay, welcome to this podcast.
Hi, Julia.
Hi, Julia. Thank you for having us.
Actually, the honor is all mine because you've just released a new article which is called COVID-19 and the Workplace, Implications, Issues and Insights for Future Research and Action. And this was just freshly published by the American psychologist. So I'm very thrilled to be doing this.
Thank you.
Thank you.
To start with, would you be okay to introduce a bit what drove the writing of this article and how did it came into being?
Well, if I may start, we have to go back to March when the pandemic, which was already happening in Asia, was also showing signs of emergence in Asia and also in Europe and also a little bit in the US. And as it was clear that this was becoming not just a local thing, but a pandemic, a worldwide pandemic, I thought it would be a good opportunity to get scholars, scientists in industrial and organizational psychology together to discuss amongst each other what are the sort of psychological implications of this, particularly for the workplace and for workplaces around the world. So we already had an example, I think, because there was already a study published on the social psychological consequences, so in terms of social distancing. And so we put together a group of experts. Well, I first approached Jay, representing Asia, if you like, National University of Singapore, and then Kevin, representing the American angle. Kevin Kniven is professor at Cornell University. And the three of us together, we had various meetings whereby we had two choices. One choice was to write a review paper ourselves with the three of us, but that would be maybe a little bit shallow because we're not experts on all aspects of work and organizational behavior. And so the idea grew to invite the experts in various domains that we thought were of interest, were affected by COVID-19, to provide some input in our writing process. And that is what we actually did. And Dr. Kevin Kniven, who's not actually at this meeting, he actually was the driving force behind it. So he's also the lead author of the paper, we should say, because without him, I don't think this would have taken off really. The writing process was such that we first selected the topics. So just as one example, we thought, hey, COVID-19 might have different implications for workers based on their personality or based on their sex or based on their race and ethnicity. And so we thought, okay, who can tell us something about individual differences in response to a crisis such as these? Who can tell us something about gender differences maybe? Who can tell us something about virtual teams? Because that, of course, was the norm for once the COVID-19 situation set in. And so we selected topics first and then identified the key players, the key scientists in these fields. And we were very happy that we ultimately collected a group of 29 in total authors. That includes the three of us, Kevin, Jay, and myself as the coordinators, if you like. And I think each of the people we approached via email was willing to contribute. So that was a huge success, and it showed the urgency and importance of this topic too.
And a great endeavor, because I think you've managed to do all of this remotely.
Correct. Yes, that is. I think scientists, of course, have a good sort of a way to work remotely, because most of our projects involve remote collaborations with people on the other side of the planet. So, yeah.
You've mentioned individual differences, virtual teams. What other literature did you look into?
We looked at a number of topics, right? So, we had a much longer list of topics, when we began. And so for example, we looked at loneliness at the workplace. We looked at, things like whether when people come to work when they're still sick, and this idea is called presenteeism. How is that impacted by the pandemic? So we literally it was like a brainstorming process, between Kevin, Mark, and I, and it was really amazing how when we came at things from a different angles, like we would all do our homework and we would come into the meeting and we would have similar thoughts. So we kind of created this shared understanding of what's going on, identified the topics. And like Mark said, we really were amazingly, we are very grateful to all the co-authors who actually agreed to do this. So, we know that many people are in different situations, scenarios, with work, care arrangements at home, childcare, many different situations. So people immediately said yes. And some of them really, went beyond, they had so many personal emergencies, but they still contributed to this despite all the challenges on their time. So we're very grateful for that. So there is a list of 9 topics that eventually ended up in the paper. But within those topics, there are actually subtopics. There are really 9 broad headings, which, I think in the show notes, you will have the link to the original article. But we had a longer list. And in the process, as peer review processes, some topics got merged into other topics, some topics got left out. So we ended up with those 9 headings that you will see in the final paper. But there are subtopics as well within those topics.
Yeah, and in terms of literature, if I may add, because this is really important. So even though it's called COVID-19 in the workplace, we actually have very little data in the paper. There's no data in the paper. It's a review paper, but also no studies directly related to this pandemic, because it's been going on only since February, March, and now we see an emergence of actual studies, data on how people cope with this specific pandemic. But the intention of this paper was really to review from past research on all kinds of different crises, including 9/11, for example, which was also a crisis, a different one, but in some ways also mobility was removed for some time being. Certain areas, certainly of the US, people didn't go to work for a limited time. The same with the economic crisis. And we even go back historically to the Spanish flu, which was a pandemic that hit the world just as the First World Wars ended almost 100 years ago, more than 100 years ago. So this was really a paper where we thought, let's look at the solid evidence. What do we know about virtual teams, for example? There's been an existing literature for 20, 30 years on this topic. So what do we know if you compare virtual teams with face-to-face teams? And so we hope that this paper also has some longevity beyond COVID-19, because it deals with all aspects of a changing workplace, from more face-to-face interactions to more remote interactions. And one thing I think that is really important, and one could consider that as a weakness of this paper, but it's also clearly conveyed in the paper. Take the literature on working from home. That's also been studied for 20, 30 years, even since probably the oil crisis of the past century. But of course, working from home for many people was a privilege. It was something that they negotiated with their employer. And so extrapolating the evidence from working from home to this situation where 80, 90% of the workforce suddenly, abruptly and mandatory had to work from home, that's quite difficult. And these limitations, I think, must be taken into account when you read our paper.
So who should read this paper? Who is this intended for?
So it's a great question. So I think, the way we wrote this paper was intended for both researchers as well as practitioners. And just to step back also, to go back to what Mark was saying earlier. So there is no data in the paper, right? So in that sense, there is some speculation in the paper. But if the speculation was from the three of us, and we can't be experts in all of these areas, the speculation is from scholars who've studied some of these topics for many, many years. So what you're getting is all of those years of insight and wisdom being distilled through their writing. So you're looking at this pandemic through their lens. So that's what you're getting. So that's the first. So as a result, we've written this for researchers. There is a research implication in the paper, but there is also a very strong practical implication because practitioners are able to pick the brains of these experts through this paper to really say what would these experts do given this novel situation that has emerged, even though we don't have data, because we can't wait for the evidence to build up before we act. So we need to act on the basis of what we know now, because those actions will have real consequences for people in the workplace.
And I've read it, of course, and you split it in three main subjects: changes in work practices, changes for workers, and moderating factors. And
Right.
you go from prior research to the actual COVID-19, and then the need for further research and the future roadmaps for research. Let's step a bit and start with the beginning. If you think about history, what have we learned, or what should we have learned?
One of my expertise is deep history, our evolutionary history, and we start the paper with that, and we end the paper also with that, because history, of course, gives us a great sort of telescope to look far into the future. And so one of the things that I've been doing is looking historically at the relationship between societies that have suffered a great deal from pathogens like viruses and bacteria and whatever, and see how their organizational structures and societies have evolved. And one of the relationships in that literature suggests that societies and organizations that are more likely to suffer from pathogens are societies that are more closed, more conformist, lower tolerance for deviance, more adherence to rules, more adherence also to authority. And so this kind of sort of deep history gives us a sort of view of what would happen in terms of a reaction to an immediate infection threat that is affecting us. And so that also has an implication for workplaces. And we see, of course, a shift in workplaces from more open, more flexible to more closed workplaces, if they are reopening under strict rules of hygiene and registration, who's in the office and who's not, and all those kinds of things suggest that there is a big transformation going on. And that is suggested really by sort of deeper historical evidence.
Did you see any resemblance between what has happened previously with the Spanish flu, during hurricanes, 9/11, and all of the other crisis events with what has happened in COVID-19?
Yeah, so in some ways, it's a crisis. And a crisis, of course, is a situation where people are highly uncertain, where, as Jay earlier said, you have to act before you have all the knowledge. And so, but it's also different. So we spend in the paper talking about social distancing, for example. And social distancing is, of course, an adequate response to an infection threat. But it's not a natural response to a crisis, because as you see from hurricanes or terrorist strikes or whatever, you see usually as a response that people are sticking together. and there is a high sort of degree of loyalty to each other, solidarity. That was also somewhat the case here, but it was, of course, moderated by the fact that in order to tackle this crisis, we really had to not be close to our colleagues or our family members, particularly if they had some infection risk. So in some ways, this crisis is very different. And then you look at other pandemics, including the Spanish flu, for example, that has really changed society a great deal. So one of the things coming out of that particular crisis was an increased concern for the health and well-being of employees. For example, large-scale insurance schemes were developed in both Europe and the US in response to this particular pandemic. And so we will see these big shifts again with COVID-19, as we are already seeing.
So let's then touch on the now and talk about the changes in the work practice, the changes for workers, and the moderating factors of all of these.
In the paper, we go through different trends that we see that are coming, right? So if you look at the emergent changes in the workplace, even since we wrote this paper to now, there are already shifts happening, right? So that's the pace at which things are going. So we look at three main salient changes that are going to come in the work practices. The one is the shift to virtual work. We call it work from home. It could also be work from anywhere, but it's work from home for now because there's not too many places you can go to other than home right now. It's a virtual teamwork. How do you work with others in a virtual team that Mark already referred to? And how do you lead and manage people virtually? And that's a big topic as well. So those are three changes in the emergent changes. Then we look at how are things going to change for employees and workers. So the first is social distancing that Mark already referred to, and how this is not natural for us, and what is the cost of this from a mental health, physical health perspective. And I don't even like that word social distancing. Actually, we could have used a better word like physical distancing, but that's what the WHO, I think, or whoever came up with it, called it. But there are costs to that. And closely related to that is the health and well-being. And Marcus also referred to that a couple of times. I think that's going to be a big change. The employers actually are going to have to pay more attention to health and work. And people, things like mandatory sick leave, is just going to be a no-brainer after this kind of a pandemic. Those sorts of issues are going to come up. The other big one, which also was compounded by all of the Black Lives Movement in the US and the related protests that happened in so many parts of the world around inequality, and closely related to inequality is also unemployment, because people are being furloughed. There are loss of jobs. I think we are having record unemployment claims in many parts of the world. So that's the other thing. And then we bring what's called a moderating factor. So the moderating factors are really it's a technical term. I think practitioners would understand it as contingent factors, which is that these changes are not going to affect everybody equally. We've already seen, for example, women have had taken a much larger share of the stress at work. There are some other industry reports that have come out that have said similar things. And so we look at demographics, so race, gender being some of them. And then we look at individual differences. So psychologists have a rich tradition of studying personality. So is everybody going to be affected similarly? So we speculate on whether certain personality profiles, for example, extroverts versus introverts, are they going to be impacted differently by these changes at the workplace? And culture or organizational norms, as we call it, whether tight versus loose cultures are going to be impacted differently. Are people, for example, when you issue an order like wear a mask, how are cultures going to even adopt these practices depending on the tightness versus looseness of the culture? How do you punish those that break the norm? So there are these differences. So we really classify them into three different areas. But this is not exhaustive, right? I must hasten to add, it's not like we've covered everything possible. We did this fairly comprehensively at that time, with fair amount of time pressure on our hands. I believe that we have been quite comprehensive. There are some other attempts to do similar things, and there's a fair degree of convergence. And we are happy to, if practitioners or listeners to this point out some omissions, we are happy to take that on board. It's not meant to be the holy grail of the pandemic and the workplace, but it's meant to be provide you with some kind of a roadmap going forward.
Yeah, no, I would echo that. Of course, we couldn't treat everything. So the 29 of us, we are primarily psychologists, industrial and organizational psychologists. So what we didn't talk about, for example, is how exactly physical spaces in organizations are going to change as a result of COVID-19. And so the actual design of workplace, we didn't talk so much about that, and also not what happens to multinational corporates, for example, as a result of a global economic downturn. I mean, these are very important things for management scientists to study, but we didn't deal with that. We narrowed it to what are the emergent changes in work practices and what are the emergent effects on the workers. And so these are the two main aspects we focused on.
And I think mostly of interest for everyone if we need to narrow it down. If you were to synthesize the main takeaways for organizations and employees, what would be those from already existing research?
Wow, well, that's a big question. We do summarize that in the actual paper in a large table, but I think for each of us there are also different takeaways given our own interests in terms of research. So my research interest is in leadership, for example, and as Jay already hinted at, I think the nature of leadership and the skills that leaders need during and maybe even after COVID-19 will have to change. And so one of the things that really this crisis has shown is that leaders need to be more aware about health issues, both compliance to health regulations in the workplace, to make sure that all team members and employees that they supervise adhere to the rules and stick to the rules. And we know from research, for example, that men generally are a little bit less adherent to these hygiene rules than women. So that's an interesting moderator, if you like. And the other aspects of leadership is, of course, the well-being, the mental well-being of the remote workers. If you don't see them regularly and you don't speak with them regularly, how do you know what's going on? Do we know enough about the domestic situation of our workers? Here you see, of course, a sort of trade-off with privacy issues, which we also deal with in our paper and say, well, this crisis makes probably clear that there are also limits to privacy in the sense that you do want to know more about the domestic situation of your workers. You do want to know about any underlying health conditions that they may suffer from, because that's important information once people return to the workplace. And so more focus on health-oriented leadership is one thing. And in combination to that, with that is sort of the idea that particular leadership styles, like leaders who are highly concerned about their status, who are more dominant in the workplace, socially dominant, these kinds of leadership styles may be less effective in a COVID-19 working world, where if you're working online, you can't show to your employees the big corner office that you have, the nice clothes, the secretary that you have that is a barrier between you and the rest of and so all these sort of cues of status and dominance have more or less disappeared. And maybe that is a sort of a reality check. What is leadership really about? It's about competence and commitment and care. And if you show that combination, you may be an effective leader. So one of the projects emanating from this may be looking more at how effective is a more feminine leadership style in the workplace as it is affected by COVID-19, and how ineffective is a more masculine leadership style where it's more sort of dominance and control based. That's just one of the takeaways, I think.
Thank you, Mark.
Yeah, so I can kind of chip in, and like Mark said, there is a whole bunch of things one could study, and that was really the purpose of this paper too, is to generate those many different avenues of research. Personally, for me, along the lines Mark already shared, is on mental health and wellness, right? We are seeing reports of increase in calls to suicide hotlines. There is also a certain right now, I think fatigue is setting in. I mean, at least we are coming to now 6-7 months into this pandemic now, depending on how you count the start date of the pandemic. And now I think there is no end in sight, So what started off as hey, work from home. Hey, this is all fun. My dog is with me. My wife is with me, or my partner is with me. Started off as somewhat fun initially, but now reality is hitting in. That is, if you still have a job, that's the whole sobering element of it. You're at one level grateful that at least you have a paycheck coming. You're working still, if you are, and then there is this whole lack of social connection, lack of communication with your colleagues on a regular basis. So work as a respite is something I heard recently in one of my conversations with a senior person. He said, "Look, I actually realize now that for me, work is what kept me happy because I didn't have to deal with those difficult things at home. So I would just take my business trip and go off to the other side of the planet and just not deal with all that, right? So you have to deal with some of those. So work has different roles it plays in people's lives. Work could also brings meaning to you. So if you're not going to work, and if you're working from home and you don't find that sense of connection and meaning, so there is so many different things to think about and talk about. And now, we are looking at this mass experiment having gone on for a few months now. So new habits have now set in. Right. So it's not like this sudden shock and things back to normal. Suddenly organizations are now realizing, hey, we could actually get more productivity from our workers when they work remotely, and we don't have to pay the real estate cost. Mm-hmm. So why do we need to bring them back now? So people are beginning to ask some of those questions as well. So this is going to be a big exogenous shock whose ripples are we going to see for a long time to come. And when we wrote this article, we weren't even sure of that, right? We weren't even sure how long this would last. In fact, we were in quite a bit of hurry to get this published because we're like, oh, what if in August this is no longer a big deal and people will not be concerned about our article? Unfortunately for the world, but somewhat fortunately for us, this is still important, and it looks like there is no end in sight. So who knows how this is going to go on.
Yeah, I think if I may add, we also wanted to write an article that would not just be sort of dealing with the short-term consequences of COVID-19, the sort of sudden mandatory working from home, but also a sort of perspective on what a workplace could look like that maybe is better for people's mental and physical well-being in the long run, even better than before the crisis. And so one of the sort of messages, I think, coming out of this paper too is, well, what a post-pandemic workplace may look like is something where people are more flexible in going to the office, not on a 9-to-5 basis every day. Why, if you want to do a piece of work that is really demanding all your attention, you can maybe easily do that at home at your computer. but work and the office as a place where people come to network, socialize, develop ideas, be creative, brainstorm, etc., as a sort of a meeting place, as a hub. I think that's one of the sort of prospects, I think, for the future of work coming out of this crisis.
You've already started to talk about a bit what's going on to happen in the future. But in the article, you mentioned future roadmaps for research. So what are the questions that we have unanswered and that you do want to answer through research, maybe research that has already started?
Yeah, so some of the research that I do has to indeed concerns leadership and how leadership will have to change and how we can implement leadership development programs where there's more emphasis on health orientation. So that's one aspect. The other aspect we're looking at in terms of our research is these moderating factors. As Jay has already said, and it's also clearly conveyed in the paper, remote work may be good for some people, but it may not be so good for everyone. And so depending on both what profession you have, if you're an IT worker working on a piece of dedicated software where you solely work independently, then maybe remote work is for you. But if you are highly interdependent on the inputs of other people in your work, then maybe it's not so good. People who live alone, for them work has a different meaning because going to work is also a place to socialize. And so for people who live alone or people who live with families or with housemates, the effects may be quite different. And so these moderating factors still need to be studied in terms of their importance. And that is what currently research groups around the world, including our co-authors, are doing.
Yeah, so I echo that. And my focus has been on understanding health and wellness and seeing if we could use, how could you use things like mindfulness, for example, with Julia, you and I have spoken about before, can help. And we also are looking at how can people manage the fatigue of just being in front of a Zoom call like we are now. How do you do this? How do you actually reduce your fatigue? How do you function optimally in these sorts of engaging with these sorts of tools? And I have another project where we look at how can you be creative in virtual teams? What does it even mean to have engagement and creativity in virtual teams? And how does hierarchy help or hinder that process? And there are many tools available now, which many people are adopting. Like, we used to just use emails as the default mode of communication, but now there are other tools available like, Slack, Microsoft Teams. There are many things going around. How does the adoption or use of those tools help or improve virtual team functioning? So there are many, many different questions. Really, honestly, for a social scientist, very rarely do you see such a large exogenous shock to a social system. So it's really like so much to study. There's a lot to study. I think infectious disease, obviously there is a lot to study, but for social scientists as well, this is a remarkably rich time. I know we shouldn't be happy about it because, there are many people are suffering, but really I feel quite blessed and fortunate actually to be a social scientist in the midst of these times because it offers so many opportunities.
Yeah. Yes. And ultimately, even the virologists, epidemiologists agree that this really, in the absence of a vaccine, can really only be tackled by behavioral intervention. So that's exactly the kind of interventions that we look at in this article.
How long do you think this new research will take? 6 months, a year, 2 years, until we can give back something to the practitioner community?
Yeah, that's an excellent question, Julia. And there's a paradox here, and we're acutely aware of that. The paradox is that society wants immediate answers. So we have a problem now. We need a solution today, or maybe even yesterday we needed a solution. And so there's enormous pressure on scientists and the scientific community to provide quick answers. But unfortunately, as we made clear also in this article, a lot of the research that has been done in the past didn't specifically look at virtual work under a pandemic. And so these are added complexities. And the scientific community, I think, would do well to be a little bit cautious in coming too quickly with all kinds of interventions or solutions based on evidence from, I don't know, maybe data collected very quickly over the internet in one specific organization or in one specific culture or nation. And so I'm a little bit worried about that. We have the peer review process in science, which should prevent that. But of course, journals are also competing with one another, and they want the best and quickest and hottest COVID-19 results. But I think we should be a little bit careful in extrapolating from all the data that are gathered now to real interventions. That takes time. I mean, just like a vaccine may take years to develop, some of this also takes years to study, unfortunately.
And fortunately, if we do get good database, fact-based results. But you mentioned academia and you asked them not to jump on conclusions, but I think it's even more dangerous for organizations to jump to conclusions and jump on the best practice wagon, because that they see others do something and they believe it's good for them as well. Are there areas in which you would caution organizations and you would tell them, hey, better sit or ask someone who knows, ask an expert, don't jump on best practices because this can have dire consequences on what you're doing? Any kind of alarm bells that you would ring up front and say, let's wait and see what the research will say?
Yeah, so one thing I've noticed now, this is just an anecdotal observation, this belief that, mental health is an issue. So what do? Let's introduce virtual coffee hours in the morning, and that's it. We're going to create bonding and, communion, and people are going to be fine. And my responsibility is over as an organization, right? I think these are fads. These are kind of quick fix fads. They're easy to implement. I'm not saying don't do it, it's better than nothing. But I think you need, as practitioners, dig deeper. And here I have, since a number of practitioners might be watching this podcast, so this conversation, I really urge organizations to engage with researchers, in terms of data, in terms of providing opportunity, because research, like Mark said, is a very, very long process, and it's a cumulative process. Even before we know something about a phenomena, many different groups of researchers work on it, and we do what's called a meta-analysis, where we look at all of the data and then we cumulatively can say, this is what we know about a domain. We don't have time for that at some level. We have to generate evidence quickly. And I think the social science community has reacted remarkably quickly. Many people are doing lots and lots of work. So if a researcher comes to you as a practitioner and says, hey, I'm doing some work, can I collect some data? Do you have access to some data? Please open your doors, because you're actually doing a service to the entire community by actually providing data, because we don't know much unless practitioners give us that data and are willing to collaborate with us and generate these joint insights. So I have had more conversations with practitioners in the last 3-4 months than I have ever done in my past, because I would just sit in my ivory tower and do my research in the lab. But now I'm like, let me go out there, talk more with the practitioners and see what kind of data we can gather. So please open your doors, I think, is what I would tell practitioners listening to this.
Yes, I very much agree with what Jay says. And I think one warning, which I think Jay already also expressed, is employers might think now at the moment, that remote working situation is actually going quite well. Productivity hasn't declined. I can save some costs maybe and not build these big offices, etc. But I think that is really counterproductive because what organizations should be doing, and probably should already have been doing, is to develop blueprints for a corona-proof workplace, essentially, or a pandemic-proof workplace, where indeed the workplace has still a function. And we know that from all the research that face-to-face interactions with colleagues are really very useful. They're very useful for productivity, for sense-making of work, for developing your competence. The whole mentoring of young colleagues is really helped by these informal face-to-face interactions. And so what organizations should be doing is, rather than say, oh, this is the new situation that works fine, we can save costs. No, they should develop smarter ways and safer ways of workplaces, of people getting back to workplace and making use of the benefits of face-to-face communications, because that's been the norm for millions of years for human beings, face-to-face interactions. And to suddenly remove that, I think is maybe on the short run, it sounds attractive, but it's not a long-term solution for designing the workplace.
Jay, you mentioned how organizations can support academia to carry on further research. Are there certain data points that you look at? Something that if organizations hear this, they can start collecting this data so they can make it available to you. You can carry out your research. And then, as we do now, we share this publicly with them so they understand what are the results. What kind of data do you think would be necessary to collect?
Yeah, so, even, I mean, that's very large question. It could be so many types of data, but I think, at the minimum, I think organizations should be doing surveys or interviews or however they want to collect that data on what is going on with their employees right here, right now, right? Like, how are they coping with this? How is their mental health? How is their physical health? How is their relationship with their coworkers, with their leaders? They need to be collecting this data. In the past, maybe they would have done this once a year, because that's how this performance cycle would probably work. Now they need to do it more frequently because things are shifting, things are changing. So things they would do, much longer time duration, they need to do it more frequently. They could also build some of these measures into the work practice on a regular. So if you have an agile stand-up, Scrum meeting as a software team, at the beginning and the end of a Scrum meeting, have some kind of check-in process where you would collect some data on engagement, on well-being, on conflict, on many things like that. So you could, and there are very simple scales available. If any of the folks listening are interested, I think if they get in touch with either Mark or I, or any of our co-authors for that matter, they're all doing some amazing work, and we're happy to point that out. And surprisingly, many of this, are not even, they don't even cost anything. As long as it's used for research purposes and one of us is involved and it goes through a peer review, we can sign non-disclosures. We don't need to disclose the name of the company. That's the arrangement that I have with some of my conversations that I'm having now. We help to collect the data. We provide the insight. We help you create enlightened, data-driven, evidence-based policies. In return, with the names of the organization taken out, we publish peer-reviewed research. That's really the process. And I really think that that symbiotic relationship can benefit both parties, because as academics, we want to have an impact. We want to impact scholarship as well as practice, being in a business school. So if that process can work, it would really help everyone.
And how can they reach you? So if anyone decides that, yes, I would like to run to collect some data, run some experiments, provide the data to researchers, should they reach you? Should they reach directly the organizations? Is there a point of contact, someone who can direct them? Because some really have never carried out this kind of experiments and they don't know how to do it, even if they would like to participate.
I mean, if they write to Mark or me, we are happy to, and maybe we can leave that in the comment section of the show notes. And I'm sure either of us will respond really quickly. And we will also put them in touch with the right person to speak with, because they may be interested in a topic that was covered in the paper that we were not directly responsible for. So we will put them in touch with the appropriate. For example, if they talk about mental health, we know who we need to put them in touch with. So we are happy to play that role of the coordinator to make sure that those conversations happen.
Perfect. Thank you so much. And through this, I think we all urge everyone to read the paper. We will definitely link it in our postings, so everyone can see it and have access to it. Read it and direct questions to Mark and Jay if you have any. And Jay,
and to Kevin also as well.
Kevin
I just want to acknowledge Kevin's email address is in the paper as well. So that's easy. He's easy to reach. He's the corresponding author of the paper. I'm really missing his presence here because he was also an important force to get this done. So he has been great with communicating with the appropriate stakeholders. So you write to him, he will put any of you in touch with the right person.
And I'll contact him, and maybe we can discuss a bit of more on how this paper was put together, so we can acknowledge all the researchers that have participated and how work was carried out. And then maybe later on we even go into the depths of each field and discuss in more detail, so it's more clear to everyone what we know, what we don't know, what needs to be researched, and what are the conclusions that they can draw and what can they use in practice. Thank you so much.
All right. Thanks for your questions, Julia.
Thank you to both of you.
All right. See you later.
See you.